All right, we are just going to give it a moment to let people roll in since we have two different breakout sessions right now. I'll give it a second and then we can get started. All right, so let's just get going with our intro here. Welcome to our breakout sessions. This is just a quick heads up. You're currently in room 1 with Brian Blackburn Jr. from Wholescripts. If that's exactly where you want to be, great, stay put. But if you're actually looking for the session with Ryan from Evexia, that is happening in room 2. No worries, just check the agenda tab and hop right into the correct breakout room that suits you. Now, here's what you can expect in this session. Brian has put together an in-depth look at optimizing supplementation in holistic health. He's diving into how to create personalized protocols, integrate automation, and use digital tools to improve client outcomes. You'll get the best practices, real-world applications, and a closer look at how Wholescripts makes supplement management more efficient and effective. So settle in, get ready to take some notes, and let's hit play.
All right, hello everyone, and good afternoon. My name is Brian Blackburn Jr., Chief Strategy Officer for Zymogen and Wholescripts. And today I'm going to be presenting a little bit about integrating supplementation to your practice, some of the new tools you can use to really improve that patient adherence, and really just streamline revenue, and some of the things that we've been helping our practitioners with, and really have seen some nice improvements and results from. So before I get started, I do want to thank Practice Better for reaching out about this opportunity. They were actually one of the first companies that we integrated with at Wholescripts. So, just great people, great company. So I really appreciate the opportunity here. And with that, we'll dive right in. Okay. So I'm sure some of you may be familiar, but if you're not, who is Wholescripts? Who is Zymogen? So Zymogen is the initial company we launched here. My dad actually launched it. We're a completely family-owned and operated company based in Orlando, Florida. And we really specialize in providing, science-backed, high-quality formulas, mainly for the practitioner channel. This has kind of evolved over the years. We've become more a now omni-channel brand, but still maintain that clinically based line, very high quality formulas, and we'll always say, our products are best, utilized under the care of a practitioner. And then Wholescripts is a platform we introduced in 2020, and this is really a practitioner tool to help them keep everything in one place. So what we did is we introduced additional brands. So we have 100 brands, and we won't go above that. It's a more tailor-made approach, and it's products and brands that our practitioners are utilizing in their practice in addition to Zymogen. So we listened to them and said, what specific brands do you guys like? What do you utilize? We're going to focus on getting those in. So that's what we did, really. So we have those 100 other brands in addition to Zymogen. And then we also have many other tools like our MedPacks technology, which are personalized dose packets. I'm going to get into a little bit more here in the presentation. Really cool opportunity there to personalize things. And we also obviously have our integration partners. Each are companies like Practice Better. And then we're also integrated with tools like Get Healthy, and then lab companies as well. So just some really cool tools on there, opportunities, and technologies that help streamline things, and really provide additional services to practitioners. So Zymogen provides the formulations, while Wholescripts is on the tools and services side, with helps with the ordering, the tracking, and direct to patient options. So on Wholescripts, we do have a practitioner portal, and then we also have a patient portal. So both of those serve its purpose, and our practitioners really like utilizing that. As I mentioned, it kind of keeps everything in one place, and they can also track their patients on there as well. And together, we feel they create a seamless ecosystem for practitioners that enhances clinical outcomes, and really helps that patient's adherence, that we're going to kind of get into more in this presentation. So, why are supplements important? We all see articles, we see videos on social media, the nutrient gaps are prevalent in today's society, whether it be, the modern food production, certain lifestyle factors, even if you follow the healthiest diet, it's just tough with the way our food is manufactured and what's now added into these, different options. So the gaps certainly exist. And as we know, the functional medicine space is a root cause approach. We're not just trying to put a Band-Aid on things. We're trying to get down to the fundamental issue here. And really supplements help support that and support that long-term solution, immune function, and performance. So, obviously a lot of us see these numbers as well, but it's kind of still, shocking to me when I look at these and see, globally where people stand and how their micronutrient numbers are deficient. 33% of the nation has, vitamin A deficiency. 50% has a vitamin D deficiency. 53% has a vitamin C deficiency, and 66% is calcium deficient. So there's certainly, a lane for supplements and to exist, not just exist, but help these people, make sure they're getting the nutrients they need to be healthy and live long lives. So there's, endless options out there. And I know a lot of people get overwhelmed and you want to know, who exactly you can trust. Those practitioner recommended brands are generally the ones you really want to look for. Mass market supplements, the ones you find in supermarkets and Amazon typically tend to lack that quality control that, those other professional brands are doing. The transparency, the clinical validation, the certifications they get, they just don't do the due diligence that other brands are willing to do. So common, some of those common certifications you want to look for is, obviously GMP is a big one. NSF is a big one. We're actually NSF certified our products are, as well as our facility here on site. And then some additional ones is NSF for sport and informed sport. These are important, especially with those sport nutrition products. You certainly want to be looking for these on the label because this makes sure that if they were any of these athletes that are getting tested in professional organizations, this ensures that they're not going to test positive for any banned substance. So certainly want to make sure that's on there. And then TGA is Australia's very high pharmaceutical grade certification that companies can also get certified on their products. So I kind of alluded to Amazon here, and this is always shocking to me as well. But Now Foods, a respected brand in our space, they do something pretty cool here. So what they do is every once in a while they'll go out and buy a number of products across a certain category and actually test them to see what they're claiming on the label. Is it really matching up with what's in the bottle? So just last year in 2024, they did a study on SAMe supplements. And out of 24 brands tested, 20 of those, which is 83%, failed the potency testing. So what they're claiming on that label is not accurate, with 16 containing less than 20% of the label potency and 6 containing 0 potency. Like I said, just shocking to see, and really scary stuff when you think about it, because people are actually going and buying these supplements not knowing that it's not really doing anything, and actually it could be hurting them in the end. In 2020, they did the same thing with PS supplements, 43 samples from 15 brands, and 36 of those 43, which is 84%, failed the potency requirements, and 17 of those contain less than 10% of what they were claiming on that label. So this is why you just have to be so careful. You have to do your homework, and you want to make sure you're working with professional brands who do things the right way, and go and add in these additional certifications to let you know that they're taking the appropriate steps to make sure what's in that bottle is what's on the label, and it's actually helping you in your health. So now we're going to get into something I call the PEP approach, and this is a great way to maximize that supplement's adherence. a common theme we hear with practitioners is making sure their patients stay on the products, the protocols, what they're prescribing them. So many times, it's a struggle. They're getting information from social media, they're getting information from TV. They're hearing all these different opinions, especially in today's age, and they just kind of seem to fall off and not follow. So these three tools are what we've noticed have successfully increased patients' adherence. And the three tools here are protocols, education, and personalization. So protocols, obviously these are structured, research-backed plans, and these ensure consistency and optimal results. Education, like I said, a lot of patients are getting their education from numerous resources today, but when they're more informed, they're more engaged and more compliant and proactive in their health. But you want to make sure their education is coming from the right places. And then we'll get a little further into that and how to kind of get creative there and provide that to them. And lastly, and I think might be the most important thing on this to really maximize patient adherence is personalization. Tailoring things to what they need really maximizes the outcomes, and I feel keeps them on track. And then in a little bit here, we're going to get into some of the tools that Practice Better and Wholescripts have on their platform to really utilize personalization and are really innovative and cool. So the first P of the PEP approach is protocols. So you want to keep this simple, clear, structured plan. Like I said, anytime you confuse patients, they tend to get overwhelmed and kind of get off track. So you're keeping it simple. You're building consistency. So when a patient has a set routine, it tends to help them stay on track and reduces those drop off and missed doses. And then protocols are nice because as we have on Wholescripts and Practice Better, you can easily adjust these. So if there's a certain thing that they want to add in or take out, simple tweak helps them not get too overwhelmed, but kind of helps them just adjust to that change a little more easy. So here's just some screenshots from the Practice Better portal, which I think are really cool in ways that you can introduce protocols. So the thing I really like about Practice Better is not just the supplement protocols, but you can add in nutrition protocols, you can add in lifestyle protocols, and put this all into one package. So it makes it really cool, really easy. Yeah, I find it hard, for someone to drop off when they have this kind of structure, and just following simple things, and where they can go in and kind of get reminded of the protocol they're supposed to be following, whether it be their meals, their supplements, or simple things like going on a walk or working out, every day. And then this is more on the Wholescripts side of things with protocols. So what we have on Wholescripts is we have set protocols that you can create as the practitioner for your patients, or we have condition-specific ones that we've developed and our medical board has developed that you can easily drop in to your patients. And like I said, we've noticed anytime, protocols seem to come into play, it does improve that adherence, and patients tend to enjoy and kind of like utilizing protocols more than a random collection of supplements. It just kind of keeps them engaged and really have a set goal in mind of what we're trying to improve, whether it be gut support, whether it's energy support, whether it's immune support. When they have a set target and a set just condition they're trying to pursue, we notice that it tends to follow through a little bit better. So the E of the PEP approach is education. Anytime that a patient is more educated, they're more engaged, they understand the why, and they're more likely to follow through. It also builds trust. Educated patients believe in the plan, making them more committed. Anytime you have full buy-in, they're usually going to follow through. And then obviously, it empowers them to make better decisions. So when they have knowledge, they feel like they are more in charge and they can start to make decisions along with your guidance. So it keeps them consistent and proactive in their health. And an interesting stat that I came across was, studies show that 85% of patients who received constant education remain compliant compared to 55%. And we're going to get into a little more about ways that you can implement education into your practice here. So how can you implement education? I think some of the easiest ways is, patient friendly, any kind of marketing material, easy to understand guides, videos, handouts on the supplement benefit and proper usage. So at Zymogen here, we offer this in plentyfold. We make sure that practitioners are fully equipped with simple flyers, brochures of what each product does for their patient. Because when they understand that this product will help them with these certain conditions, like I said, they're going to be more willing to comply and work with you and take that product and stay on that product. Another trend right now is we're seeing a lot of practitioners create short educational videos on social media explaining supplement science and benefits. So you're equipping your patients with education so they know more about what's in that product, what exactly it does for me, and that helps them just kind of stay on track and go, yeah, okay, that's why I'm on that supplement. It's going to help me with this, or it's going to help me with that. Education is such a key part in today's day and age, especially with the ways in which you can consume it. So if you're able to offer education strictly through your practice, and whether that be literature, brochures, or even videos, it's only going to help patient adherence. And then another thing we're seeing a lot of our practitioners doing is hosting live webinars, Q&A sessions, or even group discussions or meetups. Because anytime people are able to share how a certain product has helped their condition, that only enforces to the community how it's helped, and maybe other people will want to use that product as well. So anytime someone is able to get additional education about a certain product, a certain ingredient, certain condition, it's only going to help increase that adherence and help them stay on certain products. So here's some of the ways we introduce education through Zymogen. So what you see there in the first video on the left is our medical director giving a little short, it's generally around a minute or two video about just a certain condition and kind of ways you can naturally combat that, or maybe a certain product that helps combat that. And then the second graphic there on the top, simple, lays out 4 big points of what the product does, easy to understand, easy to read. And then the third point is kind of more of a descriptive post where we go more into, why metabolic health matters, why you should be looking into certain biomarkers there or monitoring that, and how it affects overall general health. So these are just kind of some sample posts that we run, and we really notice help, not just patients, but these help practitioners, because this is easy stuff for them to just drop in, use on their channels, repost, send out. So it just kind of makes it easy, because when you create this, it just helps provide those patients with additional education that they may not be getting. So the final P here in the PEP approach, and like I said, which I think is the biggest one, is personalization. We all know how big it is right now, and how it doesn't matter the industry. People are looking for unique, personalized things to them. So it's important because patients tend to stick to plans tailored to their unique needs and goals. It also increases engagement, and you really optimize results, when it's personalized. And a cool stat here is, personal supplement plans have been shown to increase patient adherence rates by up to 20%, leading to improved health outcomes. Like I said, it's something that's very trendy right now in the industry, but you have to find a way to kind of curate and tailor things for the patient so they feel like what that product does or who that product for is unique to them. And then here's some of the ways that we introduce personalization through Zymogen and Wholescripts. So this is really cool. So that box on the top left there, that's our MedPacks technology I was referring to previously. And those next two pictures there of the dose pack, so that's what it looks like. So it has their name on them. It has AM, PM, whether they take in the morning or at night. And then whatever supplements that they are on, it lists them there as well in the quantity. So these are all personalized. They can swap things out, they can tweak it, or you can have the practitioner do it for them. And then another really cool feature of this is personalized boxes. So a lot of our practitioners will actually go out and personalize these MedPacks boxes to make it unique to them. And I think this is almost just personalization to a T, and one of the coolest features that we're offering. So it's big right now, and it's really a differentiating factor of setting yourself apart from other companies out there. And then this is a pretty cool and eye-opening stat I felt on personalization, which we gathered through data collected from our MedPacks usage. So when you have a patient getting an order from a practitioner's office, they tend to order that 1.5 times before they stop taking it. Now, when they're ordering it through your online store, that increases to 3 orders before they stop. Now, here's where it gets really interesting and really cool. When you have your online store with the auto ship and they're signed up for that, their increased purchases goes up to 7 before they discontinue using the product. And then when you get them on a technology like MedPacks, which is personalized, 9.5 orders before they stop taking it. So what you do with personalization is you make something so sticky that they can only get it from you, and they feel it's so unique that they have a hard time, not taking it, giving it up. So that's kind of the key here. One of the main reasons we developed this technology, and like I said, one of the tools that kind of practitioners can use to say, here's something that'll separate me from Amazon. Here's something that's going to separate me from them going to get their vitamins from the supermarket. So this is, like I said, just a really sticky play here and something that's really beneficial for clinics. So, leveraging technology for seamless integration. Like I said, some of my favorite things about Practice Better are they're really at the forefront of utilizing technology to enforce and improve, patients sticking with the plans practitioners are introducing. Their mobile app is great. It's one of the cool things that I've kind of got to look at. It sends reminders, easy ordering. You get push notifications, so you can reorder instantly. The client portal, which is cool. You can plan and track, what exact supplements you're on, when to take it, and then you see, the practitioner gets updates, of how the patient is doing. And then a really cool thing is the telehealth integration, which is obviously so important in this day and age with so many patients now opting for this option to see their healthcare provider. We actually have data to show that patient visits going into doctor's offices post-pandemic is down 20%. So having this kind of option is critical because people are looking for this convenience. Obviously the pandemic just changed a lot of things. So adapting and having this type of tool available makes it easy for people to stay and patients to stay, in your ecosystem, with that practitioner. So, real-time virtual visits are really cool and really almost needed in this day and age. So same thing for Wholescripts here. Just really simplifying the dispensing, the compliance, the adherence. Like I said, it's a one-stop management tool where you get Zymogen plus 100 other brands, all vetted, all professional, all high really quality. And then we also offer the automated ordering and refills. Auto ship makes it easy. Everything is you can have the drop ship option right from here, straight to your patient. And then, like I said, the MedPacks daily doses. Those are just really differentiating factor, makes it really convenient. And those can all be, adjusted based off of what you need per month. So you don't have to stick on a certain path. You can actually go in, take one out, add another product in. Makes it really convenient. And then the last point here, which I haven't mentioned yet and is really cool, is we have an on-site pharmacy. So we're actually able to package pharmaceutical grade products into those dose packets that I've had on the photo there in the previous slide with supplements. So we can package a Zymogen formula as well as a other professional formula and a pharmaceutical in one packet. So that's just kind of more innovative, groundbreaking, I would say, and something that really completes our just practitioner tool on Wholescripts and makes it really easy for patient adherence. Okay, so as we're wrapping up here, I didn't want to forget to tell you guys, I'm not sure, you might have seen our social media posts or email blasts about our biggest Zymogen experience. Our Zymogen experience was our founding event that we launched in 2003. And it has since turned into a powerful educational event where key opinion leaders come to, they speak at. It's a great community hangout. And we usually have it in Orlando here, but this year we're taking on the road and we'll be in Dallas April 12th and 13th, so a little less than a month. And this year we have a brain health theme. We know this is a topic people are interested in, they want to learn more about, so we decided to focus here. So every talk will circle around this theme here. And our keynote speaker will be none other than Rhonda Patrick, who also goes by Found My Fitness on her social platforms and is without a doubt, one of the leaders kind of in the brain health space as well as the fitness space, and kind of introducing these benefits and how the science has shown how beneficial exercise, lifestyle factors, supplements, all this stuff can really benefit the brain. Other speakers include Will Cole, Anna Kabeka, and Dr. David Hassid. And exclusively for you guys, Practice Better Summit attendees, you can get 50% off tickets. So this is either in person or virtual. The code is right there on the screen, capital PBXX25. So all you have to do is go to zymogenexperience.com, go to buy tickets, and then there'll be a little place for a promo code, and you will get 50% off, and that's in person or virtual, those tickets there. So would love to see as many of you guys there. If not, the virtual is a great option. From the comfort of your home, you can listen to these big key opinion leaders and people that are really providing the powerful education that so many people rely on this day and age. So really excited for this event and excited we can extend this offer exclusively for you guys here today. So in conclusion, if you have questions or want to kind of continue this discussion, would love for you to reach out to me with any insights, updates. I'm going to leave my email here on the screen, just brianjr@zymogen.com. And then my LinkedIn page, all you have to do is scan that QR code and it'll take you directly to my LinkedIn page, and Instagram as well. We'd love to stay connected with any of you guys. Love to learn more. I'd love to kind of expand the community of functional integrated medicine. But yeah, that about wraps things up here. Like I said, I really appreciate Practice Better and giving me the opportunity to come on here and kind of explain a little bit more about what we're introducing and what we've seen work as far as integrating supplementation to really improve compliance, adherence, all those things. So thanks again, and look forward to staying in touch with a lot of you guys. Thank you.
All right. Thank you guys so much for joining us for that session. We are just going to be pushed into our next sessions now. So be sure to check out the agenda to see that you're making sure you're in the right event, and we will see you there, whichever you decide. Thank you so much again, and talk to you all very soon.